May I now request Secretary Department of Animal Husbandry and Dairying, Shri Naresh Pal Gangwarji, to make his brief comments.
Thank you, Principal Scientific Advisor, sir, uh, my secretary colleagues in the Government of India, representative of the state government, and ladies and gentlemen. First of all, I would like to thank Principal Scientific Advisor, sir, and his team, and ICMR for providing this platform to me for sharing what my department is doing and contributing in this One Health mission. This platform is a true reflection of the approach which you, sir, which you were talking about in his initial remark, that is whole of society approach. Not only representatives from all the stakeholder departments of Government of India and the state governments are represented here, but also several representatives from the society are also represented on these platforms. The importance of One Health, as has been talked about by the previous speakers, I would not go into that. We all know that animal is the starting point of many of the diseases. 5 out of recent 6 WHO public health emergencies of international concern had animal origin. We have got around 536 million livestock population, and if we add poultry, that is 51 million, both put together becomes almost similar to our human population. And animal health, as I have pointed out, that it is the starting point of many diseases. That therefore, animal health becomes a very important concern and a very important aspect of our One Health approach. Ministry of Department of Animal Husbandry and Dairying has been systematically working on preventive, curative, as well as surveillance part of animal diseases. Under the preventive animal health program, we have a very ambitious and very comprehensive program of universal vaccination, which covers foot and mouth disease, brucella, PPR, and CSF. And it is a 100% centrally funded scheme. And in past few years, we have been able to cover 1.23 billion animal with FMD vaccine, 47.7 million brucella vaccine, 270 million PPR, and 8.7 million CSF vaccine. We all know that brucella is a zoonotic disease, so there is always a danger of spreading this from the animal to the humans if it is not controlled well. These programs will certainly reduce the disease burden and genetic spillover risk of these diseases. We also support vaccination against other economically important diseases as per the state priorities under these programs. Apart from that, we have, because India is a very big country and we large with this kind of large population of livestock and poultry, it is very important to improve our service delivery to the animal. And the biggest challenge in animal disease control and delivery of services is that normally humans, when they fall ill, they seek medical services, whereas in case of animal, they don't seek. We have to provide those services to animal, and that is why our service delivery to animal has becomes very important. And in order to improve our service delivery of animal health to the livestock and other animal population, Honorable Prime Minister in March 2024 launched Bharat Pashudhan National Digital Livestock Mission. This is a platform where all the animal are registered, and through that we are effectively delivering our vaccination and other important services. This platform is also providing inputs to our disease surveillance programs, so for early detection and forecasting of disease. And one of the institute under ICR, Nivedi, Bengaluru, is doing extensive work on disease surveillance and forecasting using these data being generated from National Digital Livestock Mission. Apart from that, we have been working in strengthening our laboratory network. 5 regional disease diagnostic laboratories and central disease diagnostic laboratories are functional, but this is not seeing the size of country like India, much more work is to be done on strengthening our lab systems. And recently, under G20 Pandemic Fund, we have got a grant of 25 million, particularly focusing on improving our lab infrastructure. And that work is going on, and ministry is focusing on improving our lab infrastructure through our other schemes also. And this is going to be one of the major focus area coming forward from here. Then, as has been pointed out, that One Health approach requires joint collaboration and joint action by all the stakeholder ministries at the Government of India level. So, One Health national joint outbreak response team has been established, and the ministry is extensively participating in the actions being taken by this. We established One Health support unit in the ministry for helping states to develop their One Health action plans. And state of Uttarakhand and Karnataka have been helped to develop their action plans as a pilot project. Several other activities like holding One Health camps, community awareness program, and other things are being done continuously by the ministry. As I pointed out, that going forward from here, we need to really invest on improving our animal veterinary healthcare system, and states has a very important role to play. Ministry, with the help of states and in consultation with other experts, is developing a standard norms for establishing veterinary health institutions at village, at panchayat, and other levels. And very soon we will be issuing this to the states, and we'll hope that states will adopt that minimum standards and improve delivery of health services to the animal. Apart from that, several mobile units have been set up and things like that have been done by the department. At the end, I would say that this is a very important platform which you have provided us, sir, and this will bring this approach of One Health at the in the national discourse. This has already been done by establishing this national mission, and ministry will contribute in every possible way in and whatever are the role which have been given, which will be given to the ministry, will participate and deliver this vision of One Health to the nation. Thank you, sir.
Thank you very much.